I'm Archie Phang from Ncma Nurse Caregiver Management Alliance. I am here to discuss the 10 qualities of a caregiver. Number 1, patience. Patience is the ability to wait or to continue doing something despite difficulties or to suffer without complaining or becoming annoyed. You have to such a lot of patience when dealing with your patients. As a caregiver, we need a lot of patience to our patient. Number 2, cherry de minor. Cherry de minor is a situations and help your patient feel more cheerful. As a good caregiver should also be able to find clever ways to incorporate fun into your patient daily routines. Example, showing them a good body gesture, a smiling face, and more love and care to our patients. Number 3, multitasking. Multitasking is the 2 or more things at once to address the needs of your patients. Number 4, being able to think quickly is need to acquire knowledge for good directed behaviors and for priority settings, decision making, and problem solving skills. Being able to think quickly is you have to think quickly the needs of your patients. Number 5, punctuality. The fact or quality of being on time. To be punctual, you have to arrive the right time point in time. Punctuality is not about being on time. It's basically about respecting your own commitments. Number 6, willingness to learn. To acquire knowledge of a subject or skills through educations and experience. This willingness to learn is to give you extra education and knowledge and also the skills. Number 7, being a good listener. Being a good listener is to pay attention to the person who is talking or who's speaking, to keep eye contact, to show interest by nodding or by smiling at appropriate times. They make sure that they understand what has been said by repeating in their own words. Example, the doctor instructions, you have to listen eagerly. Number 9 is willingness to go extra miles. Willingness to go extra miles is willing to make a special effort to do or achieve something. For example, your employer or your patients need to move other places or they need to go to other house. It is also your responsibility to follow your employer or your patients. But if you cannot, you have to tell them your reason, your valid reason. Number 10, being able to take responsibility. Being able to take responsibility is the duty or obligation to satisfactorily perform or complete a task assigned by someone or to your employer. Being able to responsibility is caregiver qualities that you need to have a responsibility to take care of your patients' daily routine and to your job. And that's all the 10 qualities of a caregiver. Thank you. Number 8 is kindness and empathy. Kindness is a type of behavior marked by acts of generosity, consideration, or concern for others, like your patients, without expecting praise or reward. And empathy is the intellectual identifications of the thoughts, feeling, or state of another person. Kindness is empathy is the extra care and love to your patients. Hi everyone, I'm Archie Phang, a trainee of Ncma Nurse Caregiver Management Alliance. In this video, I will demonstrate the transferring the patients from bed to wheelchair and wheelchair to bed. Before you do that, make sure that you done your hand hygiene, and assuming I done my hand hygiene, and make sure that before you put the patients into the wheelchair are always remain locked, so that it's not is it safety for the patients. And Before you start, make sure that you provide privacy, close the curtains of the aircon, close doors, and make sure the patient is in a comfortable way. So I will start. Hi sir, good evening. I'm Archie Phang, your nurse caregiver for today. I'm here to transfer you to the wheelchair. Is it okay for you, sir? Okay, sir. May I know your name? Okay, Mr. Smith, how old are you? 80, sir. Okay, sir. I saw your record that you has a dementia and a mild stroke, but still can move. Let's start, sir. I will transfer you. Okay, sir. I remove your blanket and I let you come in this side and cross your legs, and I will get up you and sit down. 1, 2, 3. And sir, put your arms into my shoulder and I count 3 to put you in the wheelchair. 1, 2, 3. Okay. And make sure the wheelchair is locked and the foot of the patient is put in the proper way or in the foot range of the wheelchair. And after that, I will transfer the patient from his wheelchair to the bed. Sir, I will transfer you to your bed. Let put your arms into my shoulder and I will count 1, 2, 3 to put you in the bed, sir. Okay, sir? Okay, sir. 1, 2, 3. Okay, sir. And I will put you down. I count 3. 1, 2, 3. And okay, sir. And that's all. I put back your pillow. And that's all my demonstration. I hope you got it. After that, before you end your doing this to your patients, anything you do to your patient, make sure that after you done, you do your hand hygiene, wash your hands, and document everything. Thank you. Hi everyone, good day. I'm Archie Phang, trainees of the Ncma Nurse Caregiver Management Alliance. I'm here to demonstrate the bed batting procedure. First thing to do is to hand wash, assuming I do hand washing. And before I proceed, I do my sanitize. After that sanitize, prepare the equipments. My equipments is 1 bowl of water and another one for extra. And the towel. The soap and the lotion is optional. Before you proceed the procedure, make sure the privacy. Close the curtain, off the aircon and the ceiling fan. Hi sir, good day. I'm Archie, your nurse caregiver for today. I'm here to do your bed bath. But before I proceed, sir, may I know your name? Okay, Mr. Smith. May I know your age? 75. And may I know if are you okay? Are you feeling good? Okay, sir. Thank you. And now we proceed to our bed bath. I want to change your blanket, sir, into the towel. Please let me know if you are not comfortable. And may I put the towel in your head? Sir, are you okay if you have a pillow or I remove your pillow? Okay, you're okay with pillow. Thank you. Thank you, sir. Next, assuming there is a water inside, and let's try the patients if the water is okay for you. Sir, may I let you try the water? Okay, sir. Is it okay, sir? Okay, sir, thank you. Then, uh, now let's wash the face from eyes to chin to the neck and do the same way on the other side. First one is the front one, and the other side, and the forehead to the face and to the nose. And then the neck and the ear, same that side, and dispose. And take the towel and tap dry. Sir, is it okay for you? Are you feeling comfortable? If not, let me know, sir. Next, put towel under arm. Sir, I put the towel under your arm beside and fold the towel in your arm. Take the wet towel and put a little bit of soap from finger, assuming this is the finger, tap clean like this one, and the other side from arm down to the underarm. Take the towel and tap dry. And do the other side. Fold the towel, dispose the towel and take the new one. Again, put a little bit of soap, assuming this is wet and have soap already, and from the finger like this, and the other side from the arm down to the underarm, and dispose and tap dry. And cover it again. Next one is to clean the chest of the patient, and make sure you ask permission to the patient. Sir, is it okay for you to clean your chest and down to your stomach? Okay, sir, thank you. And again, put a mild soap, a little bit. Assuming that I just covered this one, assuming I just want to let you see from this one is, assuming this is the patient cloth, and I put down from her chest, the other side, and the stomach down like this, and tap dry. Put back again. Next procedure is the legs. Put the towel under the legs, same in the arm procedure. Fold the towel down in front of you. Take the new wet towel, tap dry, put a little bit soap. Same one from the toes down, from this one the toes, example this one, assuming the toes, and fold the other one, and tap dry. Sir, are you okay? Are you feeling comfortable? And close one and do the same way, the other side. put the towel, fold the towel under the legs, from toes to the legs, and top dry. And next, ask the patient to be side so that you can clean the backside. Sir, may I let you sit aside? Lie down the side, sir, like this, so that have supported here. I put the long pillow. Example, this one is below there. So take another one, put a little bit of soup on the side, from head, neck, down to the nose. And top dry. Optional, if the patients agree that he can use the lotion for his skin, if his skin dry, or you ask the patient if he like to put the lotion or not. But I ask him a while, show me, and then I put a little bit. Lotion is optional, and ask the patient is if it's okay to his or her. Put a little bit and do the massage from the bottom to up like that. Sir, is it okay for you? And do a little bit of massage. Okay, sir. And top dry with a towel. And ask the patient to put down back again. Sir, I let you put back again. And change the patient cloth or the towel. And assuming this is the patient cloth, I put inside. And assuming the patient is using the hospital gown, so that it's easy to you to remove. And then change the blanket. And all the dirty clothes and blanket put in the basin. And put properly the patient comfortable and end the procedure. And after that, make sure you hand wash and clean your equipments. And that's all for today, my bed bath procedure. Thank you for watching. Hey everyone, I'm Archie Phang, a trainee of Ncma Nurse Caregiver Management Alliance. In this video, I will demonstrate the clean and sanitize the feeding bottles of the baby. The first thing to do is to do hand washing, assuming I done my hand washing and prepare all the equipments. But before that, make sure your surface or the area are clean. And our equipments are feeding bottle soap, assuming this is the feeding bottle soap, the bottles of the baby, the brush, and this brush is sponge brush for the feeding bottles only, the tongue, the pacifier, and the nipple brush, and a basin with soap and the water, warm water, assuming that I put already the warm water, and this one the clean water, and the other one basin is to extract how to put all the clean equipment here. So let's start our demonstration. So put all the bottles inside the basin with the soap, and let's start cleaning. And make sure that you touch the bottles inside so that you can feel if it's still oily or not. And if it's still oily, put more bottle soap and wash it thoroughly, and then wash the bottle outside, and the bottle cap, the pacifier, the bottle nipple, assuming this is the bottle nipple, and brush it inside, and make sure that there is no oily. And if you don't have the bottle brush, you can use your finger to clean it and wash it into the water with the soap. After that, transfer it into the clean water, but make sure that the bottle is not oily. It's up to you if how many times you can wash into a clean water, but for me, I think 2 to 3 times is okay. And let's sanitize. Assuming that this is my boiling water, and I put all the feeding bottles inside and put like this, and the bottle, the pacifier, and assuming this is the nipple, you put this only for 5 minutes because this is a silicone. It will burn if you put too long. And open the fire again, and make sure that you boil the feeding bottles just to 15 to 20 minutes. And assuming it is done, and remove the feeding bottle using the tongue, and put like this. Take it one by one. And that's all. And make sure that after you do your demonstration that you make clean all your equipments and do your hand hygiene. Thank you for watching. I hope you understand my demonstration. Hi everyone, I'm Phang, a trainee of Ncma Nurse Caregiver Management Alliance. In this video, I will demonstrate the infant bathing. Before that, I will explain what is infant bathing. Infant bathing is the practice and activity of cleaning an infant by bathing. It has been characterized as being fun, but care is recommended when an infant is in or around water. Most drowning deaths in children happen at home, often when a child is left alone while bathing. Bath time is not just about keeping your baby clean. Emerging science reveals multisensory experiences as critical to helping shape your baby's growing brain, with opportunities for touch, sight, and smell, and sound. Bath time is excellent time for you to nurture your baby's development. And let's start. Make sure that you do your hand hygiene, assuming I done my hand washing, and prepare all the equipments. Our equipments are baby bath, baby shampoo, baby lotion, normal water and hot water, the towels, or assuming the diapers, and the clean towel or the cloth to tap dry the babies, the basin with assuming the rubber bath, the basin with a clean water, the cotton balls and the cotton buds, assuming the temperature of the baby, body temperature. And let's start. Make sure that you inform the parents of the baby about the procedure and provide privacy. Turn off the aircon, close doors or curtains or fan, and ensure the proper lighting as necessary, and must check the body temperature of the baby, and make sure that all the materials conveniently in your side or in front of you so that it's easy for you to take, because the baby is harmful. So I start demonstrating. Before that, I put the hot water into the basin, assuming, and I put the normal water, and I have to try it into my elbow, and I make sure the temperature is 37 to 38 degree, and if it's ready to use for the baby. Next, I take the baby in the crib, assuming you hold your baby like this and put into the towel, the clean towel, and check the baby diaper. Open it and make sure that if the baby diaper is clean, if there is no poop, so you can remove it. But for me, if clean, if there is no dirt, so I leave it first, later I remove after I done in the upper side. So I leave it first, and I check the body temperature of the baby, assuming the body temperature of the baby is 37 degrees Celsius and it's normal and it's ready to bath. So in this basin, I put the baby shampoo, and this one the baby bath. So I start. I retake the cotton balls to put in the warm water and squeeze it, and clean the eyes of the baby from inner canthus to the outer canthus to the inner canthus, down to the neck. Dispose and take the new one and put in the warm water and squeeze, and do the same way the other side, and pat dry with a clean towel. Make sure that the baby will not irritate or not or it's she or he comfortable. Next, after that, clean the baby face. Take the new cotton ball, squeeze it into the water using the S techniques from forehead down to the nose to the neck. Slowly clean it the face. After that, dispose and take the new one and do the same way the other side, and dispose and pat dry. Make sure you pat dry slowly or not squeezing like this one, so the baby will not cry or feel irritating. And then remove the baby diaper. Slowly remove and throw it into the hamper or the basin, and clean the baby body using these cotton balls again, from neck to the arm, the underarm, down to the legs, and dispose and take the new one. Clean the side of the baby, the legs down to the anus, into the butt, and dispose and do the same way the other side, and pat dry slowly. And then hold the baby and wash the hair. Make sure you hold the football hold and hold like this. Make sure that you don't press too much the baby neck, so that it's not pain for her or him. And wash the baby hair using with warm water with a baby shampoo. And slowly make sure the water not enter to the eyes so the baby will not cry and irritate. And slowly wash it. After that, put down the baby and pat dry the hair and the head. And again, hold the baby again, take out the baby and wash the baby body. I showing like this hold, and but I show this like this. Make sure that you wash thoroughly the body of the baby, or use the cotton balls, squeeze into the water and wash it slowly. And make sure that you clean all over the body until the back. And dispose and put the baby down. And pat dry the baby body, or take the towel, pat dry slowly. Then take the lotion, the baby lotion it all over the body. And for me, I use the different lotion for the baby legs and the anus, because the diaper sometimes it's irritate the baby, or so that the baby will not irritate for the diapers. And put the baby diaper, assuming this is the diaper, I put slowly. And put the baby cloth, assuming that I put assuming the baby is a girl. So and that's my demonstration of infant bathing. And make sure before you end your demonstration that you clean all the materials, reusable and the unreusable, throw it into rubbish bin and do your hand hygiene. And that's all. Thank you so much. Again, this is Archie and Ncma trainees. Hi everyone, I'm Archie, a trainee of Ncma Nurse Caregiver Management Alliance here in Malaysia. And I'm here to demonstrate the occupied bed making. First, do your hand wash, assuming I do hand washing already, and I put the gloves and prepare all the garments. First is the bed sheet, assuming this is the bed sheet, the pillowcase, the blanket, and the undergarments. And I prepare the sanitizer. And let's start. Knock the door. Hi sir, good evening. I'm Archie, your nurse caregiver for today. May I know your name? Okay, Mr. Smith. How old are you? 80. Are you okay, sir? Okay, sir. Sir, I'm here to do your bed making, to change your bed sheet and clean your bed. Is it okay for you? Okay, sir. Thank you. And make sure you provide the privacy, close the curtains, off the air cons and the ceiling fans or the fans. Then start to do the bed sheet. Fold it. And let us, our patient, to put him into the side. Sir, may I let you put at the other side, because I'm doing your bed making. Is it okay? Okay, sir. May I remove your towel? Cross your legs and put the hands aside. Assuming that the patient is in the other side, and fold it. And put back the blanket. And then I need to remove my gloves because this is dirty already. And I put this in the basin, the rubbish bin. And assuming this is the bed sheet, fold it here and put it into the bed. And put the undergarments. And let the patient come back into the side. Sir, may I come? Next is ask the patient to come back here in the other side to do the other side way. Sir, may I let you come in the other side and I remove your blanket and again cross your legs and your hands up and two like this, assuming that the patient is in the other side already, and cover it back with the blanket. Next is sir, may I up your head and your pillow. And then put the bed sheet. And put back the patient and cover it. And throw the dirty bed sheet into the basin, the rubbish bin, and do the sanitize your hands and do the bed making properly. Now change the blanket of the patient. Sir, may I change your blanket? Are you okay, sir? Let me know if you are not comfortable. And throw it into the basin. Next is change the pillow case. Show me the pillowcase of there. And sir, may I remove your pillow? I want to change the pillowcase. And fold it in the halfway, like this way, and this and that. If have zipper, then close. If not, fold in that way and then put back. Sir, I put back your pillow. And that's all the occupied bed making procedure. And after you do your procedure, make sure that you do your hand wash. And that's all. Thank you for watching. Bye. Hi everyone, I'm Phang, a trainee of Ncma Caregiver Management Alliance. In this video, I will demonstrate the vital signs. Before that, I will discuss you what is the vital signs. Vital signs are the measurements of the body basic functions and routinely checked by healthcare providers. It helps detect or monitor medical problems that they can measure in a medical settings, at home, at a site or a medical emergency, or in the hospital. Vital signs include body temperature, pulse rate, breathing rate, respiration, blood pressure, blood sugar. Before you proceed the demonstration, make sure that you do your hand hygiene. Assuming that I done my hand hygiene, and let's proceed to the demonstration. Before that, make sure that you done your privacy. Off the aircon, close the doors or the curtains, and make sure that the patient is in a comfortable way. And before you do your vital signs, let's prepare our equipment. Our equipments are blood pressure, stethoscope, body temperature, pulse rate, blood sugar meter, and the record book. And let's proceed. Hi sir, good evening. I'm Archie Phang, your nurse caregiver for tonight. I'm here to do your vital signs. Is it okay for you, sir? Okay, sir. May I know your name? Okay, Mr. C. I need to do your vital signs. How old are you, sir? 75. Okay, sir. Let's start. But before that, I want you to sit down and so you are comfortable. I remove your blanket first and let you sit down. I will hang your legs in the bed. Is it okay, sir? Okay, sir. Cross your legs and I will count 3 to sit down. 1, 2, 3. Okay, sir. And I put some pillow here so you can sit properly. Okay. Sir, I will check your body temperature. Okay, sir, your body temperature is normal, 37 degrees. And I will record this. Next is blood pressure. Sir, let me put you the apparatus so that will proceed to the blood pressure check. Relax, sir, and I will start now. Is it okay, sir? Ayaw. Breathe in, breathe out, sir, and relax. Okay, sir. And your blood is normal, sir. 120/80. Sir, let me put this in your finger for the pulse oximeter. Make sure that you put properly the finger of the patients like this. So assuming this is the finger of the patients and I will try it and this is normal. The pulse oximeter of the patients is 95. Next is the blood sugar. Make sure that you clean the finger of the patients like this one. And sir, I will check your blood sugar. Is it okay for you, sir? And this one, just relax. And put the blood into the strip. And see it if what is the result. Your blood sugar, sir, is normal, 3.10. I will record. And after you done your vital signs of the patients, make sure that you put back the patients in a comfortable in the bed. And that's all my demonstration. I hope you understand. Hi everyone, I'm Archie Phang, a trainee of Ncma Nurse Caregiver Management Alliance. In this video, I will demonstrate the NGT feeding. NGT means is that a tube that is inserted through the nose down to the throat and the stomach and to the esophagus, It can be used to give drugs, liquids, and liquid food, or used to remove substance from the stomach. Giving food through a nasogastric tube is a type of enteral nutrition. Before you proceed, make sure that you do your hand hygiene. Assuming I done my hand hygiene and I put the clean gloves, and make sure that you read the patient's doctor's record so that you know the patient's medications to prepare, and prepare the patient's medications, the water, the milk. My patient's milk is 500 ml, and my patient's medicine has two kinds of medicines. Assuming that it is liquid already, I make it into a liquid, the residual or the tube to aspirate, and the empty basin to put the residual. And proceed our demonstration. Knock the door. Hi sir, good evening. I'm Archie, your nurse caregiver for today. I'm here to feed your medications and food. Is it okay for you, sir? Okay, sir, may I know your name? Mr. Smith, how old are you? 80. Are you okay, sir? Do you feel anything? Okay, sir, thank you. And before you do the feeding, make sure that the privacy, close the curtain of the aircon and close door of the fan if there is a fan. Sir, may I put you na second pillow so that you can sit it properly before I feed? And make sure that the patient is sit into 45 degrees before you proceed the feeding. And put the towel into the chest so that if there is water leaking and it is a protect. And proceed the feeding. Sir, I will proceed the feeding for you now. Is it okay? Okay, sir, thank you. And before you put the liquid, you must be aspirate residual. Open the tube and put it and full. If there is a water, then throw it into the empty basin, and make sure that you fold it after you aspirate until there is no water come out into the tube. Close it again and throw like this. And assuming this is the tube, and I put 20 ml of the water and close it again. And next is the milk. After that, I open it again. I put 200 ml first until into the tube like this here full, and after that close it again and make sure you put properly and put all again until the milk is finished. After that, close it again and fold. And next is the medicine. Put it, the two kinds of medicine. After that, you close it again. And after that, the last one is the water. Last water to put is 30 ml. And close it. And remove this one. And put it like this and close the tube. That's all. Sir, your feeding is finished. Are you okay, sir? Okay, sir, thank you. And make sure the patient is remain seated into 45 degrees until 45 to 60 minutes. And that's all the demonstration. After your feeding demonstration, make sure that you do your hand washing through the gloves and clean the medication or the equipments of the patients and document it. And that's all my procedure. Thank you for watching. I hope you understand. Again, this is Archie Phang, a trainee of Ncma Nurse Caregiver Management Alliance. Hi everyone, I'm Archie Phang, a trainee of Ncma Nurse Caregiver Management Alliance. In this video, I will demonstrate the PEG tube feeding. PEG stands for percutaneous endoscopy gastronomy. Is a procedure in which a flexible feeding tube is placed through the abdominal wall and into the stomach. PEG allows nutrition fluids and or medication to be put directly into the stomach. Bypassing the mouth and esophagus, this brochure will give you a basic perform how it can help and what side of effect you might experience. Before you do your PEG feeding, make sure that you do your hand hygiene. Assuming I done my hand hygiene and I put the clean gloves, and make sure that you know the patient's medications to feed, and prepare the patient's medication, the water, the milk, the empty basin to put the residual of liquid from the patient's tube, the two kinds of medicines, assuming that this is into a liquid already, and this one to residual. And let's start. Before you start, make sure that you do the privacy. Close the curtain of the fan, the aircon, and the door. And let's start. Knock knock. Hi sir, good evening. I'm RC, your nurse caregiver for tonight. I'm here to do your PEG feeding. Is it okay? May I know your name, sir? Mr. Chan. May I know how old are you? Okay, sir, thank you. Are you feeling good? Are you feeling something? Do you feel anything? Okay, sir. But before I proceed my feeding to you, I will put the extra pillow to start the feeding. And make sure the patient is sit into a 45 degrees and start it. Let's aspirate the patient's, assuming there is here I aspirate and throw it. Another one. If there is no more liquid come out from the tube, and then let's start feeding. Make sure that the patient is comfortable. Before you open the tube, make sure that you close it so that no air come inside. And do a spirit here again and throw it. If there is water come out more, then do until no liquid come out from the tube. And start assuming this is the tube. I put 30 ml of the water. After you put, make sure that you fold the tube or close it like this and close it again, and give the milk, open it again. You put, assuming this one, you put until the hair full, until the milk finish. Assuming this milk finish, and put again the milk one by one. After that, fold it here. And after you do the feeding, make sure that you close the tube so that there is no air coming inside the tube, and fold it, and fold into the towel and put it back again. And make sure that the patient is still remain in the 45 degrees until after you do the PEG feeding. Make sure that the patient is still remain in 45 degrees until 60 minutes, and make sure the patient is in a comfortable. Are you okay, sir? Okay, sir. I will remain you seated into 60 minutes. Is it okay? Okay, sir. Just relax. After you do the feeding, make sure that you do hand hygiene, throw the gloves, and wash all the equipment you use into the feeding. And that's all the demonstration of PEG tube feeding. Thank you for watching.